Right. So if you have read and understood considering its surgical anatomy station, kindly tell me, what are you looking at? Which region is it?
I'm looking at the bones of the pelvic region, the
Yes.
sacrum, hip bones, and the upper part of the femur,
Yes.
along with the muscles,
All right.
superficial and deep muscles.
Would you be able to, yes. If we begin from here, can you identify the structure pointing with the arrow or line?
It's iliac crest.
Very good. Can you identify this muscle?
This is Gluteus Medius.
What is the nerve supply of this muscle?
So superior gluteal nerve.
All right. If you can identify this big muscle.
It's Gluteus Maximus.
Okay. If you can identify on the other side, if you can identify this muscle.
That is piriformis.
Okay. This piriformis muscle is very important in forming a landmark. Can you please tell me?
Yes, ma'am. Below, just below the piriformis muscle, usually, just below the piriformis muscle, usually there is the sciatic nerve exits the pelvis
Very
to
good.
enter
Along
into
with
the gluteal, along with inferior gluteal nerve and vessels.
Very good. Yes. And this is, yes, the importance.
And above the piriformis.
Yes.
Above piriformis, we have superior gluteal nerve and vessels.
Very good.
Sometimes there might be a variation. Yes.
Very good. Sometimes there could be, yes, variation of which nerve? Sciatic nerve. Can you please tell me the course?
Sciatic nerve?
Yes. Can you please tell me the course of sciatic nerve?
Yes, ma'am. Sciatic nerve, it exits the pelvis below the piriformis and just below the gluteus maximus
muscle.
Can
I interrupt you for a second?
Then
tell me, after formed by, what is the root value, and then it forms and then exits?
Yes, ma'am. It is formed by the anterior primary rami of L4, L5, S1, S2, S3. It has tibial and common peroneal
nerve components both. Okay, and then it exits. What happens then?
After it exits the pelvic cavity, it would lie just below the gluteus maximus muscle, and then it would pass posterolaterally to enter into the thigh after passing between the ischial tuberosity and the greater trochanter.
Okay. And, right. If there is injury to the sciatic nerve, that occurs most commonly in what type of surgery? And how would
usually
patient...
usually in hip surgeries with posterior approach.
Posterior approach. Very good. How would the patient present?
With could be loss.
Yes. Yes.
Sorry, ma'am, I would.
There'll be foot drop. Okay. So how would you differentiate between a foot drop of a sciatic nerve than a foot drop of common peroneal injury?
In cases of foot drop with sciatic nerve, even the sensations on the anterior part of the anterior compartment of the leg would be affected.
Okay.
And in cases of common peroneal nerve, only the lateral and anterior compartment of the leg would be affected. However, the posterior compartment leg muscles would be intact.
Okay. Can you please tell me the insertion of gluteus maximus muscle?
Yes, ma'am. Gluteus maximus is mostly inserted into the tract, and some part is inserted into the gluteal tuberosity on the posterior part of the femur, upper part of femur.
Okay. Can you please tell me if you would have to, if someone asks you to check the if you have to check the power of gluteus medius and gluteus minimus, what test would you perform on the patient to confirm it?
No, I would perform a Trendelenburg test.
Yes.
On the patient.
Yes.
Patient will be asked to stand on on the affected leg.
Yes.
Where we suspect the injury.
Yes.
And then we will notice the pelvic tilt on the opposite side. And also patient would be asked to walk. So Trendelenburg gait would be noticed.
Yes. Okay. Can you please tell me, where does the iliotibial tract attach?
It starts from anterior tubercle on the iliac crest, and it is attached to the lateral condyle of the tibia.
Right. Can you please tell me the attachment of femur, Quadratus femoris, and which one is it, if you can identify?
It's the second muscle from the piriformis. Below the piriformis.
It's here. It's this one. Can you tell me the Quadratus femoris? It's this one. Can you please tell me the attachment of Quadratus femoris, please? Origin insertion.
It arises from the it arises from the lateral surface of ischial tuberosity, and it just inserted into the.
Okay. Yes, lateral border of the upper part of the ischial tuberosity. Then inserted.
And it is inserted into quadrate tubercle on the posterior part of the femur.
This muscle is supplied by which nerve?
Nerve to Quadratus femoris. Root value is L4.
Yes.
It comes from the inferior gluteal nerve.
Okay. What is the action of Quadratus femoris muscle?
It extends the hip joint, laterally rotates, and it stabilizes the hip joint. The head of the femur in this.
Rotator of the hip joint. All right. Can you please tell me, if you would have to check the sensations of yes, this will come in the other. All right. Okay. What is the dermatome of the gluteal region? How would you confirm that?
So S2, S3 and S4.
All right. Okay. Can you? All right. Well, right. Do I have any other pictures? Yes. This one. All right. Well, went. But then, can you please identify what bones are you looking at?
I'm looking at the upper part of the left femur.
Yes. Can you please?
Is from.
Yes. Yes, please.
This is the head of the femur.
Yes. 3 is head. Can you please identify 2?
2 is greater trochanter.
Yes. 4, please.
It's an intertrochanteric line.
Okay. And then 5, please.
So, lesser trochanter.
6, please.
It's neck of the femur.
9, please.
So, shaft of the femur.
Good. 11, please.
It's trochanteric fossa.
Okay, good.
On the
yes.
On the intertrochanteric crest.
Yes. 4, please.
It's the head of the femur.
Tell me the nerves. Tell me the blood supply of the head of the femur in adults.
Yes, ma'am. It is supplied by retinacular arteries, which are formed from extracapsular arterial anastomosis of ascending cervical arteries, which arise from the anteriorly lateral circumflex femoral and posteriorly medial circumflex femoral of the deep, the profunda femoris.
Good. How is it different in case of a child?
So my